I've just been prescribed an SR or SNRI, like serotonin's, antidepressant drug, for treatment of my fibromyalgia pain. Now there is a known pain treatment for fibromyalgia, but I was a little bit concerned about it because obviously it's a antidepressant. So I was thinking to myself, oh my god, is this stuff dangerous? Now, considering that it is an antidepressant, it can actually make you depressed and suicidal, according to some side effects of the one I'm taking is Duloxetine here in France. And it does make me wonder, why the hell would it make you depressed if it's an antidepressant? Doesn't make so much sense, does it? No. So, it's Duloxetine, the side effects, okay? Yes, such as allergy, insomnia, headaches and nausea, psychomotor agitation, diarrhea, xerostomia, and hypohidrosis, abdominal pain, decreased interest in sexual intercourse. I'm a bit bored of that, I had 6 kids. I know the consequences now. Dizziness, I get that. Drowsiness, I get that. A loss of appetite, no. I'm always hungry and I'm always fat. Seizures, weight loss, definitely not. Myalgia, I've only just got prescribed this stuff, so maybe I will lose a bit of weight, that'd be good. Myalgia, which basically, that's fibromyalgia, so what we treat it for, oh crikey. Myalgia basically means pain. Fibro means, the muscles and stuff. That's Latin. Bipolar disorder. I think I might suffer a little bit of that. I'm a bit tetchy, a bit snappy at times. Serotonin syndrome, which is if you're having too much, or if you've got reaction to it. Loss of strength, yes, I've got loss of strength. Hepatotoxicity, how do you say that? And ageusia, I don't even know what that is. The difficulty with moving, yes. I find I stumble a lot these days. I find that I'm not sure-footed. I think that's the phrase, isn't it? Sure-footed. I'm definitely not sure-footed. No. So, is it a strong antidepressant? Well, I suppose it depends on your dosage. Now, I've been told to take 30 milligrams a day. Now, when I looked online for fibromyalgia, they were saying 60 milligrams, that's 2 tablets. But I'll stick with what the doctor says. I'm hoping it's going to be effective, and the reason why I say that is that I can then reduce my intake of tramadol, which isn't ideal, is it? Tramadol, that stuff is, it's not great. But a lot of these side effects here, I do suffer with. So, what are the most common side effects of Duloxetine? Nausea, dry mouth, and constipation. I have dry mouth. I am nauseous at times. Constipation, no. Loss of appetite, definitely not. Well, I don't know yet. Do you know what? I've only been prescribed to me yesterday. Maybe I need to give it a couple of weeks to see how I feel about it. I've actually stopped my tramadol while I'm doing this test as well, just to see whether or not I can manage on just that. Now, Duloxetine is a high-risk medication that may increase the risk of suicide, thinking, suicidal thoughts, and it's an antidepressant, and psychiatric disorders. Is that what antidepressants are supposed to do? Have I got the wrong one? Now, why is Duloxetine oh, crikey, they didn't tell me that. Take it at night. I took it this morning. Right, why is it taken at night? Most people take it, in the morning. And if you find out that you feel drowsy after taking it in the morning, try taking it in the hour. I see. If you suffer drowsiness, I have not directly related to that tablet, no. So if you suffer with drowsiness, take it at night because then you'll be in bed anyway, so that makes sense. Is 60 milligrams of Duloxetine a lot? No, that's what they say online I should be taking, but I'm on 30. 30 milligrams a day. Some patients may start at 30 milligrams once a day for a week, OSC, before increasing it to 60 milligrams a day. Now, I think you've got to be careful also because of it can be a little bit addictive. You might have to wean yourself off it once you got on it. Don't ever get mood swings or something, I don't know. Some people have 120 milligrams a day. My God, I'm not going to do that. No. Will 20 milligrams of duloxetine help with pain? A little effect on neuropathic pain being achieved if the dose is lower to 20 milligrams. Will controversy increase to OSC? So if you have too much, it's not going to help. And you have too little, it's obviously not going to help. It's also used for pain caused by nerve damage, and that's obviously where fibromyalgia comes in. Crikey, I'm fat. I've really got to go on a diet. I used to do keto diets, and I don't know whether or not it's a good idea. Fibromyalgia, I'll have to find out. Because it works for me. I can shed quite a bit of weight quite quickly that way. So it's also used for pain relief caused by nerve damage associated with diabetes and fibromyalgia, neuropathy and what have you. Blimey. So it could help, but proof is going to be in the pudding, isn't it? You know, I'm going to have to bear with, stick with it for a bit. I'll probably go start taking it at night instead of in the morning, because that makes sense. Because I struggle with sleeping. But there again, one of the side effects of this stuff is insomnia. So it makes you drowsy, but it gives you insomnia. I don't get this. Everything seems contradictory. If it doesn't make sense, you're not really going to, believe in it, are you? Anyway, what do you reckon? And have you been taking duloxetine? Serotonins? Leave it in the comments down below. Tell me if it's helped you. Much appreciated.